Welcome to my channel, everybody. Thank you very much for joining me, and also for the new subscribers who've just jumped on and become a part of my community. I'm really appreciative of you for doing that. So for those of you who are new and don't know me, my name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that helps healthcare professionals from English as a second language backgrounds become better, more empathetic, impactful, and influential communicators in order to achieve professional excellence and connect better with your patients. So this week's video applies mainly to veterinarians or veterinary staff in general, but if you are a pet owner in general, you're welcome to stay here and get something out of it. But if it doesn't apply to you, please scroll through and watch the rest of my videos. And it's only valid that I include my dog Buddy in this video. Now, he's not very much a fan of the camera, so he will make an appearance on and off. But yeah, so in case you don't know this about me, I am a huge dog lover, and I generally love all animals, but in particular I love dogs more than anything. I'm a crazy dog lady, and actually last week I looked after one of my pet sitting clients' dogs. His name is Charlie. You may have seen him in one of my past videos, but I'm going to include pictures of the time that I spent with him right over here. But essentially last week, because of a bowel obstruction, and he had a lot of other gastrointestinal challenges as well. And his owners, who are my clients, were very distressed as a result of that, and they were pretty much on the edge. They were not sure if their dog is going to be alive or not. And that actually is what inspired me to make this video. And I also found this particular article, which I'm going to leave the link of over here and the description box, in the description box as well. And in this article, even though they cover specifically the aspect of cancer, I'm going to really apply it overall to all the other areas where veterinarians are expected to deliver distressing, challenging, or unwelcome news about the state of their the health of their patients to the owners or their clients. So I do have another playlist of where you can find other videos of delivering bad news to patients in different situations, which I'm going to leave all the way over here and in the very end of the video as well, so you can definitely go and check them out. So breaking this news of your pet being in distress can be very challenging, and it's never an easy process. You have to cover a lot of information and help clients make the decision that's going to be the most beneficial for their pet, and sometimes deal with the negative emotions and preconceived notions that pet owners tend to show in those situations. So that's why personally I absolutely love the work that veterinarians do, because it's so much more challenging, because not only do they have to work with their patients, which are the animals, but also their owners, and they have to have really good communication skills and to be able to navigate all through that. And a lot of my new followers are veterinarians, so I'm very happy to see that as well. So some of the things that I feel, just based on this article, that you can do as a healthcare professional to deliver the news of a pet owner's deteriorating state of health, whether it's a chronic condition such as cancer or Cushing's disease or whatever the case may be, and how you can show your empathy and your compassion and have a much more transparent dialogue with the clients of your clients. So let's get straight into it. Number one strategy that I would give is give your client a lot of options, but also keep it quite transparent. Now, say for example, if you have a dog owner or a pet owner and you're telling them that they've just been diagnosed with cancer, obviously they're going to have a lot of questions besides the fact that they're going to be in a lot of distress. So in this case, if they're asking you about things like the quality of life of their pet, how that's going to be like, and in that case, it's quite important that you answer their questions in a transparent and open and honest manner. Now, back in the day when I had my previous dog before Buddy, I remember she got diagnosed with Cushing's disease, and we got that report via email. And I remember in that particular report, they had given us a lot of options of what treatment method we can recommend going forward, but they were also very honest that it's not really going to impact her quality of life in a positive way, and we had to make that difficult decision to eventually get her euthanized. So while you don't have to mention that outrightly, it is important that you give your clients many options in relation to they can do to improve the quality of their pet's life, whether it's a specific treatment plan, whether it's a change in diet, it's specific medications. And so that way they know what exactly to prepare, and also fine-tune the details of what exactly you are going to tell pet owners about what the condition of the dogs would be. So number 2 would be talk about the side effects of the medication and treatment methods in a much more open, honest, and transparent manner. Now, this is particularly valid when a pet has cancer and the client is considering chemotherapy to get that done for their pets. So in that situation, some of the things that you might need to cover are weight management, how much weight the animal will need to maintain in order for the treatment to be successful, how to manage the symptoms of pain that the animal might experience, and also how emotionally how owners can give their pet the support of during such a difficult time. I get a little bit emotional when this happens because as someone who is crazy about dogs and who's got a dog who's very healthy, touch wood, but I know that there will come a time that when we're going to have to make difficult decisions for him. And yeah, this is what I really felt, that by saying all this or highlighting these particular areas, this can make the conversation much more, a much better one, that is dealt with empathy, compassion, and sensitivity with your clients. Now, in saying you're talking about the side effects, it's also equally important to mention some of the negative effects that some treatments can experience. So they can be things like appetite loss, vomiting, diarrhea, nausea, and again, if they really want to go through, give them the options of if there can be medications that the animal can be put on during that time. So having that openness is. Now, this is only if it's applicable. Consider if amputation is a possibility. Now, obviously, in a situation like if you have a cancer of a particular organ, that's really not an option. In particular, if you have a cancer of a particular organ, that's really not an option. In particular, if you have an organ that cannot be transplanted, although if that is an option, definitely give that to them. However, if there's a condition that's related to their bones or their hips or their muscle or something like that, amputation could definitely be a possibility. I remember one of my friends, Angela Gentile, I have been on her podcast previously, and she is a good friend and a colleague of mine. Her last dog, Noelle, she had to get her, Noelle passed away last year, and she developed osteosarcoma, so that was the cancer of the bones, and she had to get her dog's back leg amputated as a result of that. And she eventually went on to have a very good quality of life until it got to the point after the next couple of years she lived, and when the time came she had to be euthanized. So so that is a possibility that you definitely should include in your when you're having the conversation with your client. And ultimately, this is quite distressing, and a little bit of a trigger warning. I'm going to be talking about pet death over here. Do not bring up the word euthanasia directly and straight away. Now, in some situations, absolutely, you're going to have to disclose to clients that the quality of life of your animal is not going to be the best. If we can try chemo, we can try medication, we can try a change in diet, whatever the case may be. Unfortunately, however, it's only going to be a band-aid. It's not going to really change her quality of life drastically to a more positive one. So I think instead of saying, bringing up the word euthanasia, I can just go by the example that I just discussed with you a while ago, with the people who were treating my last dog who had to be put down. They just told us that you should consider her quality of life in making a decision moving forward. And that again gives the clients a very good set of options as to how they would like to progress, whether they want to go ahead with chemotherapy, whether they want to go ahead with radiation, whether they want to go ahead with a particular drug regime or some sort of a treatment plan, or whether the ultimate decision for them is euthanasia. And also, in saying that, make sure that you are showing transparently and authentically your support to the client, that, giving them that reassurance that whatever you choose, you as a veterinarian or a veterinary staff will be there at all times to guide them through the process and also support them in the best way possible. So these are just some of the ways in which, if you are a veterinarian or anyone who works with animals as a veterinary staff, and you are in a position where you have to deliver any type of bad, distressing news to a pet owner about the quality of their pet's life, so that all of this can definitely be applied. And check out the rest of my videos on how to deliver a bad news. I'm going to link that in the very end of the video. And as always, please make sure that you hit the subscribe button and the notification bell to make sure that you are updated on these videos that I post every single week. And also, please also follow me on LinkedIn. That's where I post most of my content. And as always, thank you very much for your time, attention, presence, and support. And I shall see you next week.